Are you a diabetic? Are you a type 1 or type 2 diabetic individual? Have you been told that you need to take medications like glipizide or metformin, and that is just the only way that you can deal with your diabetes, and you should follow some of the American Diabetic Association recommendations? Is that what you're listening to? Are you a type 1 diabetic where you've been automatically told that this is an autoimmune disease and there is no understanding as to why this is happening to you, and you just have to face the fact that you are going to be an insulin-dependent individual for the rest of your life? Have you tried different dietary recommendations, low sugar, low glycemic index dietary recommendations, and still you're having a struggle with maintaining your blood sugar levels? Maybe your blood sugar levels look a little bit better when you follow a better diet strategy, but you're probably not fixing the glucose levels on a regular blood test, or even the HbA1c level on a once every 3-month blood test. And maybe you're following the idea that type 1 diabetes is an autoimmune disease, and there is no understanding, there is no research that points to why a type 1 diabetes even develops. If that's you, or you know somebody or love somebody who is a diabetic, and you really want to find out about different strategies to help you, help them, or help yourself reverse your disease, to help you cure yourself from this life-threatening disease. Again, listen, we all know that diabetes, there's a high risk of amputation of limbs. There's a high risk of going blind. There's a high risk of kidney failure. There is a risk of these high blood sugar levels feeding cancer cells in the body. And that is one thing that we know about cancer, is cancer loves a high blood sugar level. So let's understand that there are, let's first step back and listen and begin to be willing to understand that there are other answers out there. There is research out there that points to what causes type 1 diabetes and what causes even type 2 diabetes when diet, exercise, and taking your metformin, or which you become insulin dependent as a type 2, when those methods alone have not helped you reverse this disease. Now again, most physicians in the medical world are talking about management of diabetes, management of type 1 and management of type 2. And managing is not really fixing, although let's be grateful that there are medications out there that have helped save people's lives. But we've got to be able to help you reverse your condition and help you literally rid your diabetes diagnosis. My name is Dr. Lonnie Herman, and in this video I want to share with you some research which I already pointed to in my first long, full-length documentary-style diabetes video, which is the best way to help heal diabetes without medications. I'll put that name on the bottom of the screen, and even a link to that video, that full-length diabetic research, just chock full of research out there, diabetes video. I'll put that link underneath this video on my YouTube screen, or on my YouTube channel, excuse me. Share this video with a friend. There are people who deserve to get this information. And sit back, and if you've got a pen and paper, take some notes. But really, one thing I can't stress enough upon you is that you're going to hear some information here that is so different than what you've heard before, and you deserve answers. You deserve to know that diet is only one piece of the puzzle to help you lower your blood sugar levels. And insulin is not fixing your diabetic complications, although it may help you manage, to whatever degree you want to believe in that term, help you manage your blood sugar levels. Now, blood sugar levels for healthy optimum body function without stressing the body and without leading to further inflammation of the brain and other tissues in your body. The perfect level for blood sugar numbers is between, let's say, 85 and 100. That should be a waking, fasting blood glucose level, between 85 and 100. When you're let's say, between 101 and 120, they're going to call that prediabetes, also known as insulin resistance. And let's go further. Some labs are saying that once you go above 120, and some labs say above 127. Maybe the numbers are moving around a little bit, but once you get above, let's say 127, let's go to that range, that now you become a diabetic. And once you're above, let's say a 6.5 of the HbA1c, now you really have the high risk factor of being known as a diabetic. But with prediabetes, most physicians in the American medical world are saying that when you're prediabetes, let's just, watch your diet. There's no real evidence, no effort, no diabetic program that they're giving you, and just tell you to watch your diet, get some exercise, go out and try to lose some weight, even though not all type 2 or type 1 diabetics are overweight. Actually, type 1s don't have to be overweight at all. Type 2 used to be known as the adult onset overweight diabetes, but there are people who are skinny as a rail and they become a type 2 adult onset diabetic. So let's understand that diet is an important part. It is not the only part. I'm going to share with you in this video a research, not research, well actually it is research, but it is a patient program, a protocol, or a set of protocols I should say, with a patient who came into my clinic here in South Florida from another state within the United States. And this gentleman is 53 years old. He has been diagnosed with type 1 diabetes since he was 51 years old, type 1 at 51, and he has neuropathy in both feet, and he has a sleep disorder, and he just can't understand why this is taking place, and he's a very thin man, and he has been going through some neuropathy treatments in a physician's office where he lives with many different modalities, as well as trying to follow a very good diabetic type or anti-diabetic type diet. But he's got to take those he's got to take his insulin injections pretty frequently throughout his day. None of the neuropathy treatments are working for him. They are making no difference in his numbness in his feet. The diabetic type of diet that he's following, which appears to be a pretty good diet, he is not making any headway in the reversal of his or lowering of his blood sugar numbers with his insulin injections. So he came to me because he saw my information on the internet, and here we are. So first of all, we've got to understand from a different perspective what can cause type 1 diabetes. And again, most people are told that type 1 diabetes is autoimmune, and the autoimmune diseases are unknown. Why the body's immune system just attacks its own tissue. It just sees its own tissue as invading tissue and decides to go after it. Well, there's research out there that has proven this to not be so true. That is one belief system, but people used to believe that the earth was flat until it was proven round. So let's understand that there is other research out there that points to differences of opinion, but we're going to go with some factual evidence with what causes these diabetic blood sugar changes. In this man's first examination, I found, first of all, that electricity, yes, electricity from cell phones and Wi-Fi towers, Wi-Fi signals in his town, and the electricity all around him from computers and cars and so on is causing stress to his whole system. There is a great bit of research that's been done. This is on YouTube. If you look up this physician's name, a brilliant female researcher, professor in a college up in Canada, her name is Magda, Dr. Magda Havas, and you can just click on, or I'll try to put a link here on this video about her diabetes and electricity video that she put online. Great bit of research there, proving how in some cases that the electricity was the exact trigger that made the blood sugar levels go high. Electricity. There is a way around that. I have specific skills to help remedy the electricity from the body and help you get the right devices that can help you conquer while still using all of our great gadgets in this century, but be able to protect yourself, protect your DNA, protect your cells against the electricity so it doesn't damage you and cause elevated blood sugar numbers. Now, let's look at this part of this research. In addition to electricity, we've got to understand about infections causing diabetes. Yes, I said it, infections causing diabetes. You can have infection within your blood cells. You can have infections in your pancreas duct. You can have infections in the very cells that make your insulin. You can have infections in what are known as the islets of Langerhans. You can have infections in your bone marrow. You can have infections in your liver and your gallbladder. These infections can be bacteria, they can be parasitic, they can be viral, they can be mold, they can be fungus, candida infections, and there can be various toxins as well. It's not just infections. We live in a toxic world. So toxins like plastic residues and residues from antibiotics that you may have taken over time, and pesticide sprays that are on our foods, to many different kinds of chemicals that can actually get into your body and cause deranged function of your cells. Deranged function. Listen, if you're managing, as it's called, your blood sugar levels and they're always at 120 or always at 140 or always even maybe a little bit higher, but that's the best that the doctors can get it with the medication and with the insulin, you've got to step outside the box and you've got to start looking for answers elsewhere because you are still not in a safe range. Not safe. In this man's body, I was able to check him using a very unique set of skills that I have with a very unique bioresonance testing, and we found in his hemoglobin, which is where the oxygen sits inside the red blood cells in your body, and you've got many millions upon millions and billions of these cells circulating through your system. Well, inside his hemoglobin, we found not only damage caused by electrical activity, but damage caused by an infection from his mouth. An infection that's in the jawbone leaking down into his bloodstream. We also found, I found, the MSG chemical, monosodium glutamate, which is a very neurotoxic, cell-damaging flavor filler that is added to foods. I found antibiotic residues. We're talking antibiotics that are pretty powerful, dangerous ones like Cipro in his red blood cell. I found phthalate chemicals. These are different chemicals that are found in, let's just say, in various colognes and perfumes. All you had to do was smell some perfume one time or more than one time in your life, and you can actually get these phthalate chemicals that have been absorbed into your tissues through your respiratory system. Blood circulates through the lungs, and that blood can now pick up that chemical or those sets of toxins and bring them into your tissues and even right in to your pancreas and cause pancreatic malfunction. I found penicillin, residues of penicillin inside his hemoglobin. I found the Lyme Borrelia burgdorferi bacteria inside his hemoglobin. I found gold, residues of gold metal inside his hemoglobin. Listen, the man has gold crowns in his mouth, more than one. These gold crowns are toxic mixtures of metals. It's not 24 karat gold that they put in and made a crown inside this man's mouth, or if it's your mouth with gold. These, as Germans have called the gold, fool's gold, these are very toxic, maybe even more toxic than mercury, also known as silver fillings, also known as amalgam fillings in your mouth. And the gold has dripped into his blood cell and it's making it behave abnormally. I found nanobacteria and mercury, also known as dental amalgam, and toxic mold inside his red blood cell, inside where the oxygen is supposed to sit inside his red blood cell. What does this matter when we're talking about your diabetes? This matters because let me give you an analogy here and an understanding. Is that if you were being choked and you couldn't breathe, just imagine somebody has, and God forbid this ever happens, but somebody has their hands around your throat and they are not letting you get air into your body. How stressed are you going to be? How intense, how much anxiety might you get? How stressed are you going to be when you can't breathe? Pretty stressed, I bet. Just imagine that your red blood cell, instead of it housing all of the oxygen it's supposed to house to deliver that oxygen to your pancreas or any other tissue in your body, just imagine that red blood cell is only containing half of the oxygen that it's supposed to contain. It may not show as anemia on a red blood cell test. We don't have to see anemia on a blood cell test, but you can have half the level of oxygen, or let's say 3/4 of the level of oxygen, which is not perfect for your tissues to function properly. And the other part of that red blood cell is being taken up by these toxins and infections. Just when that red blood cell gets to the tissue and it's supposed to drop off oxygen, it's dropping off some oxygen and it's dropping off infection and toxin to a tissue, and it's causing the tissue to malfunction. Well, in this round, we gave him specific, targeted remedies that are going to remove these stressors, these infections, these toxins from his red blood cell. That was done on August 18th of 2015. His next day, there had to be a bit of remedies that were provided for him to help stimulate his bone marrow, for his immune system, and his kidneys. Let's go over his kidneys, because I did an inventory. This man took me on for my whole diabetic reversal program, and I'm not here to cure his diabetes. I'm here to work with his body and help his body, help himself to fix his diabetes, to get him off of his medication, to help him eliminate it, and get his blood sugars in the normal, optimal range. So we know that diabetics not only can have amputation and can have blindness develop and other heart stresses and cardiovascular stresses, but there's also kidney damage. There's dialysis that some diabetics go through, and there are some who actually have kidney failure even after dialysis, and some have had kidney transplants and the kidneys fail and the body can't function. Well, I do a specific inventory scan on this man's body, and I can do this on yours, and I do this with other patients. And I found within the chief functioning cell within his kidney, the kidney nephron, I found radiation from X-rays. I found arsenic. I found the gold material, like what I just talked about in his teeth. I found dental amalgam. I found lead. I found dimethyl mercury compound. I found cadmium, heavy metal, dangerous, heavy metal. I found MSG. There's a pretty long list here, so keep listening. I found antibiotic residues in the kidney nephron. Multiple parasitic infections damaging, weakening, stressing the kidney. The mycoplasma bacteria, very harmful bacteria, damaging his kidney nephron. Multiple parasitic infections. These are microscopic infections damaging his kidney nephron. I found another parasite called Babesia microti, the Lyme Borrelia burgdorferi infection. I found residues and side effects from the MMR vaccine, the measles, mumps, rubella vaccine, the Epstein-Barr virus, the influenza B virus, damaging, weakening his kidney nephron. I found some other infections. In particular, I found 4 different candida infections damaging and weakening his kidney nephron. Candida albicans, Candida krusei, Candida glabrata, and Candida tropicalis. I found ringworm, toxic mold, mucor, which is a fungus. I found another couple of fungi. One is called Cryptococcus and one is called histoplasma. And I found tapeworm, 2 different tapeworm. Maybe these came from eating beef at some point in his life. Those all will have to be cleaned up. It's not just getting the blood sugars under control, folks. It's about cleaning up any infection and any toxin that can exist in a tissue in your body that will cause that tissue to fail. We're going to get to more inventory analysis on him in just a moment. When he came in for his second protocol with me, I was able to go a bit deeper into his body. And I found here, and again, I'm sharing this information with you about this gentleman because you deserve to know that there are other ways for you to start helping yourself. You can help yourself reduce and even eliminate the use of your medications. And diet alone may not be doing it for you, even though it has probably helped hundreds of thousands of people have been able to help themselves reduce diabetes, maybe even help themselves cure their own diabetes with diet. But there are some people who can't reverse their blood sugar levels, they can't stop using their insulin, they can't stop using their diabetic medications, they cannot stabilize for a long period their blood sugars on diet changes alone. And that's why we have to look further. That's why I have to look further for people to help them survive and thrive. On his next examination was the very next day in my clinic. I found with him that his gallbladder bile duct area, which is connected to the liver and then connected down to the intestines. So any stress in one tissue, understand, you're only as strong as your weakest link. So when I went to his exam on the first day with that hemoglobin, that was his weakest link on that day. Now we take away the stressors there, give the body a chance to start repairing that tissue, and it will no longer be the weakest link. But he still has another weak link in the body. Look, at 53 years old, at 60, at 40, we've been walking this planet for quite some time. We've all gotten infections. We've all been around some toxic substances in the water or in our food, and there's just no denying it. The research is out there that is compelling evidence to all this information. So in his gallbladder bile duct, which was the next weakest tissue, that tissue is stressing other tissues, including his pancreas. I found mercury, residues of mercury in his bile duct. I found periodontal infections. There's a way for me to measure what's going on in somebody's mouth, and those infections were dripping into his gallbladder bile duct area. I found vaccine side effects of multiple vaccines, including the measles, mumps, rubella vaccine there. I found another mercury called mercury dimethyl methylchloride. I found more dental amalgam mercury. I found multiple parasitic infections, and I found mycoplasma bacteria damaging, weakening, stressing, inflaming the gallbladder bile duct connection. The next part of this exam that I did with his second day with me in my clinic, I did an examination which was the next weakest tissue in his body. Turned out to be the islets of Langerhans. It was like a blessing on the second day to be able to see right into the pancreas and be able to let the body tell us, this is where I want you to go next. In the islets of Langerhans, I mean, it's just incredible that these drug companies are telling you that you can manage yourself when they're not helping you find out what's causing it to eliminate the disease. So you keep taking the medication, and yes, it may help you to live and survive. I'm not knocking that, but when you want to move past it and you want to start to really help yourself fix yourself, this is what we have to do. So in its islets of Langerhans, I found roundworm, sorry about that, roundworm. I found the Lyme Borrelia burgdorferi bacteria infection. I found multiple viruses inside his islet cells, weakening them. I found the mycoplasma bacteria weakening, stressing, damaging, inflaming his islets of Langerhans, and that, my friends, is going to cause stress with your body's ability to be able to produce insulin. If and when it can't produce enough insulin, you can't lower your blood sugar numbers on your own. In addition to a very high level of mycoplasma bacteria in his islet cells, I found residues of an antibiotic called Avelox. Avelox is in the fluoroquinolone family of antibiotics, and it is known to be very damaging to human tissues. Whether he was prescribed Avelox or Levaquin or Cipro or any of these fluoroquinolones, or if he wasn't prescribed them or you weren't prescribed them, we find them in you, these antibiotics can be given to our food. If you're not a vegetarian or a vegan and you still eat animal food like chicken or red meat, you've got to be concerned that they have given these antibiotics to the animals. And so you eat the animal food and the antibiotic is going to be in there. I found multiple foreign chemical substances, xenobiotics, inside his islet cells. I found fungus inside the islet cells, and I found another vaccine causing side effects, inflammatory damage inside his islet cells, the DPT vaccine. The DPT, the diphtheria pertussis tetanus vaccine. I also found in looking to help start to repair, not only repair the islet cells, but to repair the myelin. Because when we have neuropathy, we've got to be concerned not only about blood sugar levels, we've got to be concerned about nerve tissue, myelin tissue, which helps the nerve function. I found that his myelin is under a great deal of stress. I have samples of that tissue here that I can test the human body with and find out if it's stressed, and it was very stressed and it actually needed support. There is a way that we can actually make a copy remedy to be able to use that myelin tissue exactly to be able to stimulate myelin function and production in the human body. Now, in addition to these findings, and he was sent home on a protocol for the next over 36 days, I wouldn't see him again. I did further investigation, as I call an inventory, of his various tissues in his body. The man was curious to find out what kind of infections and toxins are in various other tissues, because we've got to understand something, that it's not just when we're finding, here it is, we're not just understanding when we're finding one tissue that can be stressed. Think of a domino effect. One domino falls, they all fall down, right? Well, let's understand that when you have an inflammatory condition in your body causing breakdown of your own naturally given, born right to be able to, in this case, balance your blood sugars, you have a domino effect. You can have infection in your bone marrow. You can have toxins in your bone marrow. You can have infections in your pancreas. You can have toxins in your pancreas. You can have infections in your gallbladder and your liver, and toxins in your gallbladder and your liver. You can have infections and toxins in your intestines. You can have infection or toxin in your blood cells, in any other tissue in your body. And as long as we have that weak link, one tissue is inflamed, another tissue can become inflamed and can be malfunctioning. Now, I found in his bone marrow. Listen to this. I won't be able to put all this information up on the screen, so just listen and grasp this, and you can play this video again and again. Share this with a friend, as I've said. I found in his pancreas he has mold and measles, mumps, rubella vaccine side effects. I found the varicella chickenpox virus in there, and I also found the heavy metal called cadmium, damaging toxic metal. I found in his bone marrow he had a Candida albicans, Candida tropicalis, Candida glabrata, Candida cruce. There was another form of Candida in there. I found antibiotic residues in there. I found dental amalgam. I found another kind of mercury called mercury dimethyl methylchloride. I found tobacco smoke. He never smoked, but he's been around. He worked in a job where there's a lot of cigarette smokers always on the outside of the building, and he definitely was breathing in secondhand smoke. The DPT vaccine, the T tuberculosis vaccine, I found toxic mold, I found parasitic worms, I found bacteria called ancylostoma, I found ringworm, I found hookworm, I found the MMR vaccine and mucor, a fungus. I found on the vagus nerve. The vagus nerve is a brilliant nerve. It's a long nerve. It comes off of your brain stem, and it helps your brain send signals down to organs in your body. The vagus nerve, I found Lyme infection. I found a parasite called Giardia. I found three different schistosoma parasitic infections. I found blastocystis. I found eggs from different protozoa. I found other parasitic worms, 2 other kinds. I found mold, and I found another bug called Cryptosporidium. Another infection, set of infections on the actual nerve tissue. So remember we talked a little while ago about his neuropathy, about myelin support. I found on his nerve tissue, peripheral nerve tissue, the MMR vaccine, cadmium, and adenovirus. It's called the virus called adenovirus. And I found the mumps virus. I found in his liver another weak set of tissue in his body causing systemic inflammation. Multiple parasites. I found roundworm, Lyme infection again. I found residues of antibiotics. I found side effects of the MMR and DPT vaccines. I found the herpes zoster virus, Coxsackie virus, Epstein-Barr virus. I found mold called wrinkle B. I found various metals, dental amalgam, aluminum, antimony, lead, arsenic, and a mercury called mercury dimethyl methylchloride. I studied his prostate tissue. I found side effects of vaccines, again, the same two that we've talked about already, the MMR and DPT, aluminum, lead, arsenic, cadmium, dental amalgam, mercury dimethyl methylchloride, influenza virus, and I found more roundworm and tapeworm in his prostate. I studied the epididymis. Epididymis is tissues within the testicles. More mercury, more parasites, more bacteria, more Lyme infection, more radiation, pesticides, and dental infections. You have weak tissue in your body and you're not able to calm down the inflammation, and that tissue is reflexing. You can have tissues that actually refer stress over to another organ. So it's not just the infection that I found in his islets of Langerhans. It's not just the infections and toxins I found in his red blood cells. It's not just the infections and toxins in the bone marrow. It's not just the infections and toxins in the liver. You are the sum of all of your parts. And what if, follow this understanding, what happens when you have 20 gang members attacking you and you are only defending yourself against 1, 2, or even 3? Let's say you're really good and you can knock out 3 gang members who are attacking you, but you still have 19, 18, or 17 other gang members right there ready to jump you, and they're probably going to win. You're probably not going to beat them, all of those gang members attacking you. So understand your body can have a gang-up effect. Not only can you have insulin resistance develop because of dietary habits, no doubt, but because of infections and toxins in multiple tissues, and those multiple tissues are not calming down because no physician has found the stress in those tissues for you yet until here with me. But those tissues are stressing your cells, they're stressing your pancreas, they're stressing the islet cells. They can cause such a gang-up effect on various systems in your body where your body will never be able to regulate its blood sugars on its own. Even if you do genetic testing, even if you look for a detoxification method like the MTHFR gene, which is only one of thousands of different biochemical reactions in the body, systems in the body, you've got to look at the information about what causes a gene to be stressed. You've got to understand that. It's called epigenetics. And what researchers have found, brilliant PhDs in cellular biology have found and have reported to the world, is that the environment around the cell can either aid the cell to allow it to function properly, or it can cause deranged cellular functions, also known as cellular malfunctions. When they put toxins, poisons, electricity by a cell, that's when the cell changed its behavior and got stressed. Further examination on this gentleman was a very unique, deeply exploratory dental examination I did with him. And one thing that I was able to find in his mouth was that in the bone in the upper right side of his jaw, he has the Lyme Borrelia burgdorferi infection there that's dripping into the body. His gums, which are reflexing down to his pancreas, there was mycoplasma bacteria in the upper right side of his mouth. I found in the that was the lower right side and lower left side, the whole bottom jaw of the gums. Sorry for that mistake. The lower right and left side of his jaw, the gums there have mycoplasma bacteria on both sides. It was the Borrelia Lyme infection in the upper right bone. I found in his upper left side of his mouth, the crowns, there is mercury in those crowns. There's that gold metal that is stressing his pancreas. He's had this one of these gold crowns for 29 years. So how long has this been in there, making his body very toxic and causing stress to his cells and his tissues? I found in another tooth residues of antibiotics and the Lyme infection. And then on the lower, left side of his mouth, I found underneath a gold crown on the bottom left jaw, I found mercury, lead, and the fool's gold that is not 24 karat gold, toxic metal compounds that are reflexing directly to the pancreas. You cannot have your pancreas and the islet cells function the way you want them to and you expect them to when you have various tissues, including your teeth, your gums, your jawbone, any other gland or organ in your body that's stressing your pancreas. So what do we have to do? We have to be able to use a very unique set of skills. We have to be able to get right down into the cells, into the tissues, without a biopsy, without any invasive testing, and find out what's in there. There is a very unique set of bioresonance testing skills that I have. I have samples of these different parts of the body. I have samples of all different infections and toxins. We're able to do a stress reflex analysis, a bit too long of a discussion for this video right now, but I can find in your tissue which tissue is weak, which tissue needs help, and what is in that tissue causing it to malfunction. And you can help yourself fix yourself. There is technology out there. You can help yourself fix yourself. My name is Dr. Lonnie Herman. If I didn't share that earlier, you can watch my other videos, share this video with a friend. We're at the end right now for this discussion. But really, share this video with a friend. Look me up on my Facebook page. I share information there all the time. Watch, click, like my Facebook page, share my Facebook page with other people, and also subscribe to this YouTube channel. You'll be the first to hear and see when I'm putting new information up, and sometimes I'm able to get new videos up on a daily basis, sometimes a few times a week, sometimes once a week, but on an average, I am here on YouTube every week getting more information out to you, and you deserve to know. You can call my clinic at 954-370-3100. I look forward to helping you get the job done. Okay? Thank you for your time. Look forward to talking to you. Again, 954-370-3100.